So welcome to Partners in Pancreatic Cancer. I am Dr. Bekaii-Saab. Today I would like to discuss which patient may be a candidate for a modified regimen of gemcitabine, nab-paclitaxel, and the difference seen in terms of the side effects and the overall survival. So when we think about our patients coming through the clinic, patients with pancreas cancer tend to be, for the most, underperformant compared to a lot of patients with other cancers. Typically have cachexia, weight loss, muscle loss, appetite loss. They're patients who are in some bad shape when they get to the clinic. And the regimens we've used so far have been relatively aggressive, and a lot of patients are unable to tolerate. In fact, about half of the patients are unable to tolerate the dosages that are applied per the package insert or per the studies. And in fact, we do have data that suggests that modifying FOLFIRINOX, but modifying gemcitabine and nab-paclitaxel may end up yielding in terms of very similar outcomes, while cutting down significantly on the levels of toxicities that typically are observed with the weekly regimens in case of gemcitabine and nab-paclitaxel. So modifications modifications of the regimen gemcitabine nab-paclitaxel are either day 1 and day 8 of every 3 weeks. The preferable one, in my viewpoint, is the every other week, day 1 and day 15, based on our publication that suggested that survival stays relatively well preserved while the toxicities get significant improvement. So overall, in my clinic at least, almost every patient that is eligible for gemcitabine and nab-paclitaxel outside of a clinical trial will get an every other week regimen of gemcitabine and nab-paclitaxel day 1 and day 15. In other practices, perhaps the patients that would be most eligible are those with, say, performance status of 1, or those that are older, that are less likely to be able to go through the weekly regimen. Of course, at the end of the day, it is important to look at these questions prospectively through a randomized trial. Thank you for viewing this activity.